And good evening. My name is Ina Kafunda. I'm a public health specialist and a lawyer, and I have the privilege of being the moderator for this webinar. The gender pay gap remains to be significant around the world, with women earning approximately 17% less than men on average worldwide. Back home in Zambia, this gap widens about 28%, and in rural areas, the situation even gets worse, with 35% of women earning less than men. This is according to the Zambia National Statistics data, as well as a research that was done by Benedict Daka. Notably, in the healthcare sector, where women make up over 70% of the workforce, they earn roughly 24% less than men, their male counterparts. Alarmingly, at the current rate of progress, it could take us about 200 years to close this pay gap. This is according to the International Labour Organization. The World Economic Forum gives us quite an optimistic estimate of us being able to close this gap in about 108 years. These statistics, ladies and gentlemen, just emphasize how bad the inequality is in the paying system between men and women. Today, I'm pleased to welcome everyone to this webinar on behalf of Women in Global Health Zambia chapter. And I'm pleased to welcome our esteemed panelists, and of course, you, our valued listeners, to the webinar. Today's webinar is under the theme, Invest in Women, Accelerate Progress to Closing the Gender Pay Gap. Like I said, my name is Ina Kafunda, and I will be moderating this webinar this afternoon. The Women in Global Health team has assembled a diverse team of experts that you will meet shortly that will give us insights into some of the barriers that are causing this gender pay gap disparities. I will go ahead and introduce our panelists. Firstly, we have Mr. Chilwa. Mr. Chilwa is a seasoned HR professional with a focus on promoting fairness and equality in the workplace. He brings over 9 years of experience and is currently serving as a senior human resource manager for the Right to Care project in Zambia. Next, we are privileged to have Dr. Nawa Mwale. Dr. Nawa Mwale is a PhD holder. She is a social science professional with over 17 years of experience. She has dedicated her career to working in academia and research and has worked for the highest educational institute in the country, which is the University of Zambia. She is focusing on critical areas such as gender equality, social inclusion, as well as environmental sustainability. We also have Ms. Pierce, Ms. Alice Pierce. Thank you for joining us. She is a researcher at the Policy Monitoring and Research Institute in Zambia. As you all know, that's a public policy think tank that we have in our country. So she will be able to advise us on some of the policies that we have around closing the pay gap that is currently in existence. Ms. Pierce advocates for social justice, equality, as well as women empowerment. Lastly, but definitely closer to my heart, is Mrs. Flata Mwale. Mrs. Flata Mwale is a seasoned medical laboratory scientist and a global health professional. She is currently the Deputy Director for Women in Global Health. She is actively involved in advocating for gender equality and women empowerment, particularly in the health sector. Ladies and gentlemen, please help me welcome our distinguished panelists, and I will ask them to switch on their videos as we proceed to dive into the questions for this afternoon. I hope Mr. Chilwa, I hope we'll be able to see Mr. Chilwa because I'm starting with him. So Mr. Chilwa, coming from an HR background, do we have any HR policies in Zambia that that are directly addressing the gender pay gaps that we're currently seeing in some of the statistics that I shared. And could you please give us some examples on how organizations can effectively implement these policies that are in existence? Mr. Chilwa.
Thank you so much. I still struggled with my video. Yeah,
That's okay.
but anyway, we'll go with it. First of all, just like to say thank you to Women in Global Health for just inviting me to talk and discuss on this key issue that just doesn't impact in terms of singular organization, but as a nation and as a world at large. So I think it's good that these topics are being addressed. And I think actually even going forward, deliberately going on the participants, going forward, we need to make sure that a lot of men as well attend such events, because I think for us to achieve this, we need to tackle it from an all-rounded perspective. If we let one gender just push the agenda, we can't achieve it. At the end of the day, it has to be pushed by both genders to make sure that we achieve this. So thank you so much for just bringing me on board. In terms of policies, I feel like, first of all, the biggest impact is it's our culture, per se, that has also contributed much to these pay gaps. In terms of culture, I've seen it around my colleagues, around meetings that we've met with HR professionals in terms of change, in terms of they think that this who's not supposed to sit at the high table. And I think the cultural norm as well has played a major role in terms of the gaps that we have now. However,
I don't know
a lot of policies have that. We have well-versed ones who. Hi.
Sorry, you were breaking. We were losing you for a second there, but it seems the network has
Okay.
Please go ahead.
Okay, thanks. Yeah. So I think, like I said, like we play a major role, especially that we are involved in the recruitment process. So one of the things that I think we've emphasized on is having policies that get to appreciate these processes that we are trying to combat or fight or eliminate in terms of gender biasness when it comes to recruitment. So you see, deliberately, the recruitment policy, any organization set up, I've worked in the mines before I joined the NGO sector. I was with Kansanshi and Kalumbila mines. And I've noted that each organization, they've got policies. And these policies, when you talk about recruitment policies, they will not highlight in there that a woman is supposed to be paid less and the man is supposed to be paid more. No, the recruitment policies are clear in terms of the recruitment. They highlight in terms of the processes that has to be followed, whether from a female perspective or a male perspective, it's a person that you are hiring. However, we still have people who you can put up a system, but remember, a system is also still being managed by a human being. But the question is that, does that human being understand what that system is trying to address? And I think that's where it's starting from. I'll give an example for me. I think with my organization, one of the key factors that we've got a strategic plan in the HR team where we've said deliberately, first of all, number one, we have to hire at least 50% male and females in terms of representation. So that's goal number one. Goal number two is that you have to look at now from the leadership perspective. So I've heard so many people boast about having, because disparities start from, first of all, the gap, not before the salaries. First of all, you have to look at the representation. How many females do you have? How many males do you have? Because it starts there. To address the gap, you need representation. How can you how can you address the gap if your leadership team has only got, for example, in terms of presence, one female person, and then against 10 males? Even if you have to set up some policy, I think you'd rather also need to put up certain female people to be in that representation group in order to address some of these gaps. So deliberately, we've seen policies being set up like that. However, also training, to do a lot of training, especially for people who are involved in the recruitment process, because that's where it starts from. The recruitment process. Ideally, it's best practice that each and every organization has got salary bands. And salary bands, you'll never find anywhere where it's written that for a woman, you have to pay them this. For a man, you have to pay them this. It actually tells you salary bands target positions. They don't target a person sitting in the position. So it's just an issue of making sure that we create more an awareness, not just at organizational level, but also at a national level. They have to be a specific agenda, I think, from my experience, because I've seen that systems have been put in place. Equal pay for equal job, I've seen it. We discuss them in HR forums. Gender neutral recruitment, we discuss them in forums. Flexible work arrangement, we've had when the stats have been done, there's still those disparities. And then you're wondering, we've put up the policies, we've put up the systems. Then what seems to be the problem? Where is the problem coming from? So it's more on the people who are in charge of the systems. What sort of training have we done? Leadership development programs. What leadership development programs have we put up in place? I still hear people say, you know, when I hire a lady, she'll get a lot of leave days, and there's maternity leave, there's now nursing leave and all that. You still have people who still talk like that. And I think for me, I feel like even the the Ministry of Labor, it has to go far in highlighting why they come up with laws like that. Because at the end of the day, if they just put up laws and say, look, we're protecting women and we want also to give women an opportunity, the people who interpret those laws, they don't interpret them as they interpret them. So I think the agenda here is to just highlight that, look, here at the end of the day, we need not just equality, but equity. And I think equality, I always tell people that I feel like we've moved so much on equality. But I think what we are fighting now is the equity. Just now, I was discussing with my team. One of my team members, who is a lady, she went on maternity leave, and then the guys are there. So there's this opportunity that arose. This lady is on maternity leave, and you know, I was looking into the system and I was thinking, who can act in this role? The closest person I'd go for, it's the female colleague who is there. Sorry, the male colleague who is there. So already, even the law itself, as much as they are saying that they've created this platform where they're giving women opportunity in terms of just equity and also privileges. But if those privileges are not managed well, those privileges can actually be the ones that can disadvantage the pay gap that we are trying to talk about. So I think just to highlight on it is that, look, we need to do more of training, but also I like what my board, I'm also an invitee to the board of Right to Care Zambia. You know, I was looking for, there's this position I was trying to close, and I was highlighting that I'm insisting that I need a female person to be in that position. And then one of the female board member there said, no, Nakambo, it's not just you looking for a female person. You have to look for a capable female person. So it also has to start from there as well, because if we need to change this landscape, the people who are given opportunity
Hello, a few housekeeping issues. Please mute your mic. Achithia, please mute your mic.
They're setting a trend. Okay. Sorry. It's also key that as much as we gaps in terms of female representation, salary gaps and all, the people who are putting in front, the people who are trying to develop to take up these seats in these boardrooms, these senior management rooms and all, we're supposed to make sure that these people are trendsetters. Because at the end of the day, we already have a disadvantage, a system that is fighting us, for example, as women. So they're looking at you with a microscopic eye, which is not supposed to be the case. The moment someone makes a mistake and then someone will start quoting things, you see that's the reason why we don't do this, which is not supposed to be the case. However, these things are reality and they are happening. So it's also key to make sure that we have capable people in this position. But deliberate policy, like I've highlighted, I think it's really key, especially for equal pay. We've got salary bands for our organization. We look at the position in terms of what we are hiring for. The recruitment process, I think the past 3 years, we've actually hired over probably 10 pregnant women. I remember one of my team member coming to me that, boss, we've got a problem. What is the problem? We found a very intelligent employee, but she's pregnant. And I was like, no, that's not a problem. You can't say that's problem. You can't, it starts from there. And you see, this person comes to me genuinely saying that, not that they deliberately want to eliminate this person. It's because they don't understand the agenda we're trying to push for. And then I was like, I think I haven't done much in my role actually as a head of human resource. It means that we have to address this agenda. So I think that's where I was coming from. As much as we set these policies, as much as we're trying to achieve these gaps in terms of closing in the salaries, we need to emphasize what is the agenda. What are we trying to bring on board? What we are trying to bring on board here is that a female employee is a human being the same way a male employee is a human being. So in terms of deserving access to salaries, promotions, trainings, they have to be given the same opportunity. The agenda, at the end of the day, as an organization, also, you're benefiting. If you're not tapping to some of these women folks that we have in the employment setup, it means that even your production will be affected because you're just concentrating on one area. So I think these policies, it's in summary, it's one thing having these policies. I've seen salary bands, recruitment policies. I've seen these platforms where they say women are encouraged to apply and all that. But I think the key issue is that why are we encouraging women? That needs to be emphasized.
Those are really, really great points. And I really appreciate how you've just started this discussion. Key things that I heard from your comments, number one, is that we do have these policies in existence, but are we implementing them? And you raise very pertinent issues like there has to be training. We have to educate, whether it is our senior management or HR personnel, to say, look, we have these policies and we need to adhere to these policies. But I would like you to very briefly comment on this aspect too. If we're saying that the policies are there, if we're saying that the salary bands are not tied to any gender, what do you think is the gap? Do you think it's because this female qualified candidate is not empowered to negotiate their salary as much as the male candidate is empowered to negotiate their salaries? What would you say about that?
I think from my experience, from the 10 years of recruitment, one of the issues, I've met brilliant women, I think, in different industries. My wife, she's a brilliant woman as well. She's an HR manager for one of the international community schools. But there's one attribute that she carries. I always laugh because I've noticed it in Flat as well. The confidence part. Sometimes I've seen it in interviews where already you see this woman is coming into a room where the interviewing panel is full of men. Already there's that aspect of some sort of intimidation if someone is not really trained well. But so I would say we really need to do a lot of empowerment in terms of from the women's side, in highlighting that the same way a male person is capable, you are also capable. You can also achieve whatever other person can achieve. So I've noticed that aspect, the confidence aspect, has to be put in place, because I've seen it where women actually are in. There's this time when one of our bosses responded to an email, just for example, an email where he wasn't impressed with how this employee sent the report that he wanted. So this employee comes to me and says, Nakambazi responded to me because I'm a woman. I was like, no. Like, I actually showed my laptop, like, this is how he responds to me as well. So I think that issue as well has to be addressed in terms of the confidence as well, but also about the people who are relaying the information. Deliberately, people need to highlight that, look, I'm addressing this to you as an employee or as a candidate, not as a woman or as a man. So I think also interview etiquettes in interviews. There's some male folks who come out the wrong way in terms of interview etiquette, how you look at a person, if you are interviewing a woman, how you make them uncomfortable, how they come out and all that. So I think those issues. So for me, it's more on training in terms of how people should interview people, training in terms of how people should handle promotions, training in terms of how people come up with these policies in these respective organizations. So for me, it's more on training.
I agree with you. And we as women as well need to be trained to be confident enough to demand that paycheck that we deserve based on the capabilities. Like you rightly highlighted, we have to be capable women so that we are hired based on merit and not because somebody's feeling pity on us, but also we need to be able to demand that pay and trained to demand that pay. Thank you so much. I'll move on to Ms. Pierce. Ms. Pierce, working at a national think tank for public policy, I'd like you to tell us the role that policy frameworks at national level work to promote gender equality, and specifically for this discussion, we're looking at pay gaps. I'd like you to just talk to us about your experiences with framing these policies, with making sure that we have policy frameworks at national level that are breaking gender equality barriers and addressing paychecks. Can you also highlight to us some of the key gender policies that you have worked on or that the country has in existence currently?
All right, thank you very much. To answer your question, firstly, the formulation of policies that seek to mainstream gender or advance the rights of women are critical in that they're firstly recognizing that there is a problem in whichever setting that policy actually sits in. The existence of a gender policy will actually highlight that there is need for this policy to sit in this particular setting. For example, maybe in the mining sector or in the land sector, whichever other sector that you could think of. Therefore, policies actually help identify the problem as well as clearly outline what needs to be done in order to address the challenges, as well as map out clear linkages for partnership and coordination, which are key in the implementation of many of these policies actually, and addressing gender problems, which tend to be quite dynamic and therefore need a multi-sectoral approach. However, the strategies that are contained within the policy, it's important that these strategies are actually addressing or breaking down gender barriers to equality or equity in this discussion that we're having, and they should be transformational in nature, in that they should seek to change the narrative of how things are done. Just like our colleague that just spoke, We also feel that gender barriers are rooted within socialization and are perpetuated by institutions such as the family or the church, for example, because these are the primary institutions in which socialization is taking place. And so themselves actually play a significant role in framing how society views gender, how society views what roles women should play, what roles men should play in employment. For example, what type of jobs women should get into, what type of jobs men should get into, and what they deserve from these jobs. So again, it's a societal issue. In terms of the gender policies, they should seek, therefore, to deconstruct these gender barriers by addressing the root cause if we are to sustain and institutionalize the change that we hope to see in terms of social behavior. To highlight some of the gender policies that are in place that have been key in terms of advancing women's rights as well as opportunities, government has actually been implementing quite a number of interventions.
Did we just lose her? Okay. All right. I think we lost Ms. Pierce. So perhaps as we wait for her to return, we'll move on to Dr. Mwale. Dr. Mwale, you've done a lot of research. You have over 17 years of experience in academia and research. Perhaps as we wait for Ms. Pierce to come back, could you tell us how pay gaps have impacted the broader social issues that we have in our country right now? And what steps are effective in addressing some of these disparities and fostering inclusive economic growth? From your experience as an academia, as well as working in research, working with the University of Zambia, what can you say about that?
Thank you so much for that. First of all, just to also add to say that I was working for the University of Zambia, but currently I'm working for Global Water Partnership Southern Africa, and I'm the gender advisor for the regional organization. Yeah, thank you. So I think that's as a way of start. If you look at the economic perspective, for instance, you find that there are a number of activities that are involved in our economy, Zambia, or just any ordinary economy, whether it's issues of production, consumption, trade, or various goods and services. So if you look at all these activities, you ask yourself to say who is involved in all these activities and who benefits from all these activities. So as we talk about issues of gender inequality, we are, of course, looking at all those social processes where people are disadvantaged or treated differently based on their gender or sex, whether it's the political, economic, or cultural terms, those inequalities exist. So now, how are these gender inequalities impacting on women, whether it's the economic empowerment or that? So a number of issues can be talked about, but I think I can just touch on a few. So first of all, look at issues of lack of access to quality education. I think for a long time now, we've been singing about issues of STEM, where women are really underrepresented, whether it's the science, technology, engineering, and then mathematical fields. And I think for a long time now, we've seen, numbers really being low. We are seeing some steady improvement, but I think we're not yet there. So I think while we are trying to address these issues, we have to bear in mind the fact that ultimately, those who work in those fields are the ones who even get more money than the other programs, where like care programs, care sectors, whether it's health or education, teachers, nurses will get lower than engineers or other professionals in the STEM field. So the lack of quality education and them not being able to participate in those fields, it disadvantages them. Apart from that, the equal pay, I think Mr. Chira has really highlighted this very well. I'm so happy the way he talked about issues of HR, where the policy will not clearly state to say the woman will get less, the man will get more, but it's the factors which influence. If you look at the sports area, a few weeks ago, we were celebrating Rachel Kundananji, a female football player, who is now the highest paid female player in the world, our own Rachel, a Zambian.
Wow.
So I looked at the figure, which is $787,000. But if you look at the men, you know, Ronaldo or, you know, these others, they'll get $260 million. So why that gap? Tennis, it's the same thing. Serena Williams has been crying over the same, and we'll go on and on. So the policy has to have provisions whereby there needs to be equal pay. What's the excuse? The same number of hours being played, you know, the same number of players in football. So what's the excuse for not giving the women the same amount of money? So issues of lack of access to land, for instance, up to this moment, we still have cases whereby women cannot, you know, own land. In the rural areas where the majority of people live, like in the Zambian case, for instance, women only enjoy land, maybe if it's, sorry, I think my internet is really unstable, it's cutting. Let me just switch off my video, so sincere apologies.
No problem.
So you find that women who access land through their parents, if they are married, through their husbands. So in a case whereby they need to have, you know, control over land, it's very difficult. Issues of access and control. You can access land, but do you have control over it? So a man will control to say, no, we can only farm this much on this portion, but you find that they have a challenge with that. And then, you know, the male-dominated fields. I'm so glad Mr. Chira talked about issues of engineering. He has that experience in that field. There are female engineers who've shared stories of where, when they get jobs in the engineering field, they're looked down upon to say, you know, you can't do this work, you can't do that work because you're a woman. And inevitably, they can be disadvantaged when getting employed in those areas. Political decision-making positions, I mean, Zambia is a very sad case. Out of 24 positions of cabinet ministers, we only have 3 who are female. We had 4, but one was removed and replaced by a man. Provincial ministers, we used to have 1, we now have 2 out of 10 provinces. Members of parliament, 15%. That's a sad, you know, aside. So I think a lot needs to be done. But when you look at the strategies, a number of issues really can be done to really ensure that we have gender equality. And I think Ms. Pierce, I think, tried to touch on it before her line cut, issues of policies. The first thing that we need to do is to ensure that we have adequate policy provisions, legal framework. What provisions do we have as a country, as an organization? Do we have those gender policies? Without those policies or legal framework, what are we going to implement? We'll have an excuse to say we can't implement because we don't have policies. So, but once we have those policies, as Zambia, we are well known for drafting very good documents. Zambia, all over the world, we are known for that. We draft very good documents, but implementation is very poor. So how do we implement those policies? So we need to ensure that we implement the policies to the latter. Right now, we have this Gender Equity and Equality Act of 2015. It provides that we need to have a Gender Equity and Equality Commission. And it's been, from that time up to now, we've not seen the commission being operationalized. Why? Because of issues of lack of implementation. So we need to invest in gender equality. I'll give you quickly an example of Burundi. Care International did research in Burundi, and they say that in the agricultural sector, that is, that in every $1 invested in gender equality programs, they get $5 retained out of that. For every program which does not talk
it's not on the vendors
or look at issues of gender equality, only $2 is realized. So you can see how important gender equality issues are. When we invest in gender equality, you have more returns ultimately.
You have to like collect the
Sorry,
Katusha, please
could
mute your mic. Thank you. Thank you so much. And just a reminder to everyone, as you join, please mute your mic, or when you drop off and rejoin, please mute your mic. Sorry, I'm so sorry, Dr. Mwale, please continue.
Thank you. I think I'll end with just two more points, Inam. So I think one is just to say we have to go beyond gender mainstreaming. For a long time, we've always talked about gender mainstreaming, but we have to go beyond that. As Global Water Partnership, we always emphasize on issues of gender transformative approaches to say we have to look at what are the root causes of gender inequalities, and then what are those harmful practices. We have to now get down and try to find solutions to those challenges. And lastly, capacity building. Mr. Chira touched on this. We really need to work on this. as we do issues of gender equality, and also as JWP, we always emphasize on 3 levels at which we need to do programs. At agency level, as an individual, what are your capabilities? What is your knowledge? At relational level, how do you relate to your family members at home, whether it's at work, it's at church? And structural level, what policies do we have? What programs do we have? So all those issues need to be taken care of. Thank you so much, Ina.
Thank you. Thank you so much, Dr. Male, for that very, very elaborate insight into what's happening currently on the ground. I appreciate that you bring out the issue again of quality education. And I know the African Union was sitting last week, and this was their theme for this sitting. The 37th sitting of the African Union was titled to promote quality education in Africa. So it really is important that we look at the quality of education that our women are getting as well. I want to push you a little bit further. I know you brought up very, very important points, but in terms of the actual implementation, we're talking about training, we're talking about advocacy and capacity building. And to be honest with ourselves, these are the things that we've been talking about for a number of years. And as you rightly put it, we do have frameworks, we do have something in place. What is the issue? What is the barrier? What are the barriers? If today we needed to come up with an action plan or for call of action, what are the 3 major things that you feel we can immediately do to influence the gap, to make sure that the gap gets smaller, like very practical, actionable things that we can do? What would you say, Doc?
Thank you so much, Ina. So quickly, I think 1 is capacity building, awareness raising. You'll be amazed that even amongst the elites, if you go in workshops or programs, people just straight away say, "Why do you care about issues of gender?" There's no need to do that. So let's just employ whoever we need to employ. Why do you keep on crying about this gender equality? Let's just live our lives the way we've always lived. So everyone appreciating to say it's important for us to have this gender equality, raising awareness and capacity building is very, very important, because it's basically us having opportunities which are equal for education, jobs. I mean, the Constitution is very clear. That's the highest law of the land, to say that we need 50-50 representation in terms of whether it's on the boards, whatever employment. So we need that capacity building and awareness raising. In addition to that, I think we need to do monitoring and evaluation, because quite right, we develop policies, the legal framework, but do we monitor what we've put in place? We have action plans that we've put up. Climate change action plan is one example that I can give. We have that action plan in the country, but have we gone back to see what actions we put up in 2016 to say we need to implement this? We never go back. We are very good at drafting it, but we will not implement, we will not go back. And I think lastly, it's just to acknowledge the fact that we have to acknowledge the problem. Right now, sometimes it's difficult for someone to be convinced to say this fight of gender equality is actually important or real. When they hear issues of gender, they just think about these disgruntled women who don't have anything to do in life who are fighting this. And like Mr. Chira said, we need to engage men, because people have always thought about just it's a women agenda. We need to engage men, we need to engage boys in all the programs we're trying to bring up for this to be sustainable and also for us to win this. Just lastly, at the University of Zambia Gender Department, actually we have more male lecturers than female lecturers. And I think that is also helping, because people are now appreciating to say issues of gender are not just about women's issue, it's everyone's agenda.
Exactly. Thank you so much. Yeah. That's very insightful. I will come back to you because I still want to push you further on who is supposed to go and review that data. When are they supposed to go back and review that data, and who is holding them accountable to review that data? So I'll come back to you, Doc. Thank you so much.
Okay, thank you.
Ms. Pierce, we're happy to have you back. Hello, are you there? Oh, I thought I saw Ms. Pierce come back. Okay. As we wait for Ms. Pierce, I'll go ahead and move to Flatter. So Flatter, we're talking about these pay gaps in the health sector as well. The health sector has been affected as well. How does unpaid work in the health sector perpetuate gender inequality, and what steps can be taken to address some of these issues?
Hi, Ina. Thank you so much for having me. And I must indicate that it's such a pleasure to be having this discussion. And before I dive into the health sector, kindly confirm you can hear me.
Yes, we can hear you loud and clear.
Awesomeness. So allow me to just speak to the background of women in the workforce. As early as the 1800s, women were able to get into the labor workforce. The 1900s was, I think, the trademark. During the First World War, the men had to go and fight, and the women stepped up and indicated they wanted to keep the economies running. And so they volunteered that they were going to come up and, be able to keep the economies running through different sectors. That they kept the food industries alive, the service industries alive. And as much as we have made that much progress, really, economic inequalities are hitting us bad. We have made progress in health outcomes. We have made progress in education. But when it comes to economic empowerment of women, we really have huge, huge gaps. And so how does it look globally? So we're sitting at 20% as a global status, where we have 20% gap between men and men, meaning I am going to get 20% less compared to a man of my same position with the same expertise, same experience, and same education level. So those get us questioning, really, how did we get here and why are we not getting away from here? And then you come to imagine that in sub-Saharan Africa, for example, we are told that 66 years is what we need to get to gender parity in remuneration. Do we need 66 years? No. Do we have time to wait for 66 years? No, we don't have that time. Women have been in the labor force for too long, and I think it's about time that we address the gender pay gap. The drivers of this, of course, Nakambo has spoken to leadership. We have few women in leadership positions. And as he explained, even when you have the chance to be one of the few women, it's very difficult to cause influence. Imagine me sitting alone in the midst of all male board members. How do I counter the policies and also advocate for these changes so that more women can be able to benefit? In Europe, for example, at managerial levels, there was still a difference in gender pay of around 23% between men and women of the same level of managerial position, same qualifications, same expertise. How do we explain that? Pure injustice in the labor workforce. We get to occupational segregation. So women are relegated to health and care work. And that is where women in global health comes in now, because naturally we are known to be nurturers and we are more inclined to get into the health and care workforce. And that is where poor remuneration is more predominant. So you find that in the sectors where women predominate, their work is undervalued. Their work is undervalued, and you don't even see men coming into those spaces because they already know that these spaces are really for women and mostly underpaid. So we really do have a lot of work. And Dr. Nawa spoke to education. We are not in STEM. STEM has a bit of equity in terms of remuneration. We have female engineers in tech and science, but then we have fewer of us participating, yet we make up over 50% of the global population with minimal participation. And again, that goes to the stereotyping that we see in the home. If you see a girl child playing with a car, what do you say? She would rather play with a doll. And so she'll pick up and think that it's actually right for her to associate more with health and care than it is for her to pick on the STEM aspects. So Women in Global Health last year released a report. It was dubbed Pay Women Report. And the findings were cross-national and were profound. We have over 6 million women that are subsidizing global health. They are either doing unpaid or underpaid work within the health sector. this is the sector where we are screaming inadequate human resource for health, but we are using women to handle the cheap and free work whilst holding communities, public health and keeping communities together. I think that requires some change. You ask me, the health sector provides an avenue for leading in remuneration, improving remuneration for women. Why? We have 70% of the global health workforce being females. If we have that and we are able to address the issues of gender pay gaps, we will be able to provide a trend setting within the health sector and get women to be remunerated as much as men. It may look small when you look at the percentage. For example, in US, you have a difference of about $20. But again, when you calculate that over the life course of your career as a woman, over 40 years of your career, you would have lost around $500,000. That's a lot of money. So economic security for women really is something that we need to carefully dig into and see how best now we can bring together and remunerate women for the work that they do. We also need to value their work. Just because women are doing it doesn't mean it's easy. Just because women are able to deliver it well doesn't mean it naturally comes and therefore they do not deserve remuneration. Women need to be paid equal pay for equal work. And we need to get to have those conversations more often. Thank you, Ina.
Thank you. Thank you so much. You raised very, very pertinent issues, very thought-provoking issues. And I do agree with you. Women's work needs to be valued, and it starts with the health sector because most of the people that are working in the health sectors are women. So we need to push for that. I see Ms. Pierce has joined. I want to give her an opportunity to finish her contribution before we run out of time. Ms. Pierce, are you with us now?
Hi, yes, I'll just keep my video off for now, just in case that's what is interrupting my connection. But I'm not even sure at what point I got cut off.
You were talking about the policy frameworks that we currently have in the country.
Okay, yes. Just when I joined in, I heard Dr. Nawa talk about the Gender Equity and Equality Act. Well, yes, those are some of the legal provisions that we have that shape gender equality in our society. And then there are also other programs or interventions that have been put in place. For example, the Girls Education and Women Empowerment Livelihoods Project. They also fast-track courts, one-stop centers, as well as advocacy surrounding gender matters that are being implemented. But all of these are coming on the backdrop of the challenges and the barriers that women and girls face. And many of them are actually issues surrounding inadequate education, skills, as well as opportunities for economic empowerment, which limits their decision-making power. From the discussions when I joined, I could tell that some of these issues have actually been spoken on. And we also see that these actually form critical pillars in determining health outcomes, as well as education outcomes, not only for individual women, but also for their children and their families, because evidence actually suggests that there is a strong correlation between education and economic empowerment of women and the health, nutrition, as well as education outcomes of their children. So if women are economically empowered, they have better education, this tends to translate into the type of children that they have and the outcomes that these children will actually have over society. Other issues, barriers in accessing economic assets, for example, such as land. This has been a challenge for many women, and it tends to actually impact quite significantly on women's economic empowerment because they lack access to finance in most cases, and they have no collateral for significant investments. So as a way of trying to avert this challenge, government has actually been rolling out the National Land Titling Program. And a key feature for this has been that women can actually document and register their land in their own right at a much cheaper cost compared to the traditional land processing system, that's also running side by side this particular initiative. And there's also a provision for multiple ownership, as spouses can actually register, both husband and wife could register as having ownership of a particular piece of land. So we think that this is quite important in that it safeguards the rights of women in terms of ownership of assets and speaks directly to their economic empowerment. Other interventions, again, many of them are largely in the education sector. Programs such as the Keeping Girls in School, which also provides support for girl children from vulnerable households to access education. And we think that many of the interventions that have been put in place in the education sector have actually helped bridge the gender parity gaps in terms of boys and girls accessing education. And this is a good indicator for the future. And we are hopeful that perhaps this could then translate into various positions at decision-making level. Again, I heard Dr. Nawa talk about issues to do with political power, and that has been a big challenge in terms of representation at that level, especially when it comes to the parliamentary level. At community level, in terms of councillors, the picture doesn't look so bad, but then when you look at the highest level where these laws and legislation and policies are supposed to be formulated and implemented, it becomes quite a challenge when you look at the number of women that are sitting in parliament. But then again, it's not an issue of just numbers. You could have a situation where you have more numbers, more women sitting in parliament, but then they don't recognize that gender equality or gender equity is actually an issue. So that could also play the other way in that, yes, you have women who sit there. We expect that they would be the voice of the many other women that are seated in the communities, but perhaps they don't recognize that there's a problem.
Yeah.
So, yeah, I think that's my contribution for now.
Thank you. Thank you so much, Ms. Pierce. I will open the chat box up for questions. So if you have any questions, please feel free to type them in the chat box. You can raise your hand and we'll give you an opportunity to ask the question. But I wanted to ask Ms. Pierce further. I know the all this policy that you have highlighted, which is good that as a country we do have those policies. And from my understanding, they're focusing mainly on formal employment. Do we have any deliberate policies that are addressing these issues for non-formal employment? For example, you know, these gigs that we have, or I have a decorating gig, you know, I'm doing a wedding, or I'm doing DJing. Is the guy doing the guy you hired to do DJing gig going to get more than a female? Do we have deliberate policies that are addressing non-formal employment to make sure that there's that comparable remuneration for both genders?
Okay,
so the government has gone to 92%.
Mulundu,
So
please mute your mic.
Sorry.
Thank you.
Yeah, so unfortunately, when we think of the informal sector, much of it in Zambia is it's unregulated in many cases, also not recognized in many cases. So there are a lot of gaps or potential for gender inequality to actually be perpetuated in the informal sector because of the nature in which this informal economy is operating. It's very unregulated. So to think that there are deliberate policies that address the informal sector, it's a bit hazy for now. But I think there have been attempts, perhaps not really in some of the gig work, but there have been attempts through institutions such as CEEC, and now through programs such as the CDF for empowerment programs. There's an attempt to sort of have these companies or people who are involved in the informal sector to sort of register and access finance that could then influence the type of work that they are getting into or structure them in a better way. But yeah, it's still quite a challenge for the informal sector.
Yeah, and I think that's where the problem could be as well, because we do have quite a number of people that are entrepreneurs nowadays. Everybody's moving towards that, and I think we need, as a country, to have deliberate policy to address that. I see Flutter's hand is raised. Before we address the question in the chat, Flutter, please go ahead.
Yes, Nina, thank you so much. I just got interested in the conversation. Great question on the informal sector. And I think this is where now even the biggest burden of economic inequality comes in for women. We are mostly found in the informal sector. We are even in agriculture, we're not doing it the formal way, we are in the informal. Speak about the minimum wage. Yes, it's been pronounced, but who checks on to see whether domestic health household helpers are being given the minimum wage? Who is there to check whether the women that we are engaging at community level are even being remunerated appropriately? For example, community health workers will get a bicycle and a phone as remuneration. You know what I mean? And then they'll be given a lunch allowance for that day that they work, but yet they show up every single day. So I think accountability will also be key. We need to have CSOs and organizations such as Women in Global Health also holding governments and institutions accountable, so that we ensure that women are adequately remunerated and that their work is reflected in their economic gains as well. I thought I should point that out. Thank you.
Thank you so much, Brilliant. And before you mute your mic, I think you can go ahead and address the question that we have in the chat. It is asking whether we could share some tips or advice on how a Zambian woman in health or STEM that is currently studying abroad can get reintegrated into the Zambian health sector once they return home. Any thoughts on that, Flutter?
Oh, yes. Well, depending on the course that you're doing, we do have integration into the health system comes in through the Health Professions Council of Zambia, HPCZ. Of course, there is the licensure exams that you have to do if you studied outside. And once you get the licensure exam, you make it through the exam and you're given a license, you're free to participate. I know a lady that studied in Morocco and she's currently employed under the government. So the system is really well established and it does not segregate as to where you studied. But of course, you have to come through the HPCZ and then the rest is easy.
Thank you. So as we come towards the end of the webinar, I really want us to take something away from this webinar in terms of the call for action. We have the statistics, we have the numbers. This is a global problem. Worldwide, ILO, International Labour Organization, is saying it's going to take us 200 years. 200 years. The United States of America has had independence for, I think, about or over that. But what can we do? What practical steps as women and men in different fields, what can we do to address these issues away from propaganda? What are the practical steps today, tomorrow, next week that we can take to begin to close this gap? And this, I'll open this question up to all the panelists. Please feel free to unmute and give your insights. But really, as we are wrapping up, we need to have something that we can go away with. What is it? What are the 2-3 key things that we can do practically to solve this problem, so that we stop talking, we stop looking at data, because we are regurgitating this data. We are re-emphasizing this problem, which we already know. And the data is good, but we need to act. We need to close that gap. What practical steps are we going to take? Any of the panelists can unmute and speak, or we can start with Mr. Chirwa.
Hi, Emma. Thank you so much. You know, I was just thinking right now, like just away from this, a simple example. You know, at home when my daughters are being naughty, my wife would tell them that daddy will come and spank you. Mostly they still continue doing it, right? But when daddy comes and says it, that I'll spank you, they stop. So what I'm trying to say is that I like what other presenters have mentioned. Daddy will come and spank you. That's your policy. And that's what is happening right now. The policies are being written. But I think for me, deliberate steps, if we are to change this, the people who are in the background at national level, the president, at corporate level, organizational level, the GMs, your directors, the SMT team, they shouldn't just say there is a policy, but they should speak to the policy. Because the moment they speak, people will start seeing that they're taking actually these issues serious. Policy is one thing, but actioning it, talking, walking the talk, it's another thing. So I think for me, it's like even at work, I always tell the SMT team that, look, we can say we've got policies, but it makes a difference when the country director holds a meeting and says, this is a direction. So look, hearing those numbers that it will take us 100 years and all that, I'm just thinking, if right now countries decided, presidents, to say there is a directive, any job that you are hiring for any position, there shouldn't be a disparity between a woman and a man. It's a directive, and no one will go against that directive. So it's possible to actually close these gaps without waiting for these years. Because deliberately, if someone can't issue that directive, indirectly we are saying they're kind of countering against whatever we're working towards. So I think that deliberate measure has to come out, and it goes across even organization. In terms of eco pay policy, my country director is supposed to direct me, Nakambo. I'll be reviewing payroll every month. I want to see what you are paying employee A, who is a woman, and what you are paying employee B. Deliberate policy. I think, is it Dr. Mwale, Dr. Now, someone mentioned about it in terms of monitoring and evaluation. That's what we need to put in. You are monitoring, you're actually seeing these indicators. And then from an HR perspective, it's Ministry of Labor. Right now, currently, the current labor laws is that they do labor inspection. They can put pay disparities in terms of gender matrices that they have to check on a quarterly basis, on a semi-annual basis. It's a deliberate policy. This can happen. Immediately you do it, it's a directive. They are policy makers. Everyone will actually follow. So I feel like, I don't know why, I feel like it's very easy, I don't know, with me to implement it if people choose to say, this is the difference we want to see. I feel like as much as we are talking about it, gender disparities and all that, I feel in the background that it's not top priority for me, how I'm looking at it. People can talk about it, these policymakers, but it's not top priority. If it was top priority, we could have seen a lot of changes worldwide, countrywide, in this organization. So I think there's more to it than just these policies. So for me, I think deliberate directive, they definitely have to be put in place.
Great. Deliberate directive or political will, or making sure the policies are actually implemented. I like that. Thank you so much. We'll move on to Dr. Mwale. Anything from you?
Thank you, Ina. Thank you so much. Yes. So before I just come to my point, I think Miriam posted a question from Sign Up Form. There was one which says, what measures have been put in place to invest women mainly located in rural areas? I want to just mention to say that in rural areas, we usually use the 2021 House of Chiefs gender guidelines for traditional leaders for management of natural resources. So this document actually caters a number of sectors: education, agriculture, water, and all that. So for those in rural areas, if this document can actually be implemented, I think it would do quite a lot. So coming to my point, just as a way of closing, I think we need to be proactive and not reactive. Many times I've seen how people just come and implement gender issues at the by the way, or because someone has complained. I don't know how many of you follow issues of climate change, but last year and early this year, we heard that because the COP for climate change will be in Azerbaijan this year, and then the whole team, as in the committee for the COP, was made up of men, no single woman. So after the backlash, they now brought in all these women and all that, but we should not do things like that. And even when we form up these committees or opportunities, we should not put women, as a tokenistic measure, like Ms. Pierce mentioned. We don't want to see these 7 women with 1 man in the committee, and we are happy to say, oh, now we have more women. That 1 man actually can control the whole group of women in talking, in making decisions. So it's about active participation. Are they really doing what they're supposed to do? Are they actively, making decisions, contributing, letting their voice heard? So let's be proactive and not reactive. Thank you.
Thank you so much. Let us be proactive and not be reactive. Ms. Pierce, what are your last remarks in terms of actionable things we could do, practical things we could do today, tomorrow?
Well, mine may not necessarily be short term. I think it's more of a long-term measure. Of course, in agreement with what the 2 speakers have already said, but I think also mindset change is a very important thing that we need to put into consideration, because we need to deconstruct these negative social norms that limit the potential of women and institutionalize or replace them with positive gender attitudes. For a long time, for as long as these barriers are rooted within socialization, it becomes a challenge to change the system, because the system is already socialized to behave or to act a certain way right from the very beginning, from the family level, from religion, from culture, and all those other aspects. So if already at that level, gender equality issues are not being recognized as a problem, these children already begin to grow with that, and then they get into the system and continue to perpetuate these challenges and barriers that we are talking about today. So again, alongside with everything that has already been said, alongside with all the policies, you can have all sorts of policies in place, you can have all sorts of legal and regulatory frameworks in place, but as long as the people do not agree that gender equality is a problem, they do not recognize that perhaps women or men are disadvantaged in a certain way, issues to do with patriarchy again, as long as these things are not being discussed, there's no deconstruction of any of these societal norms, it will still remain a challenge even to implement the very same good policies, the very same good legal and regulatory frameworks that we have. It will be a problem to implement them because the people do not believe in them.
Thank you. Thank you so much. Flatter?
Hi, Ina. Thank you so much. And really just to appreciate the submissions from the speakers who have spoken. I do agree with Nakambo's sentiments on how easy it should be if there's just a political will. We do have countries that have ratified the Equal Remuneration Convention under the ILO, and Zambia is one of them. But again, beyond that, who is really taking keen interest to know that we are living up to our promises and what we have promised to deliver for the women in the continent and also just within Zambia? So political will for me is key. I'll use an example of Iceland. So Iceland is rated as one of the most gender equal countries. And some of the work policies they have is that every company that has employees over 25 must pay women and men equal for the job that they do. Equal work equals equal pay. And as part of the regulation, these companies report to the government every month, and the government is monitoring the system to determine really how things are being done. to achieve the goal and really say we need to close the gender inequality gaps even in economic settings for women. We also need, I agree with Alice as well, we need to keep the conversations going on raising awareness on how gender inequalities continue to affect both men and women, right? And that we need to work together. We need to do the deconstruction, the addressing of stereotyping, gender stereotyping, how we are raising our children, the environment, the systemic barriers have to be broken for us to really get to where we want to be. We also need to, I agree with Nakambo, we need to improve access to employment opportunities and advancement for women. We are saying women need to take up more decision-making roles, but we need to make sure that we provide them the platform to be able to do that. We need to capacitate them to be able to do that. Of course, taking into consideration the differences in access to opportunities and also skills among men and women. We also need to ensure that women are pushed into the critical roles where men are dominating so that we can suffer that dilution and be able to also tap into the economic aspects of this gender equity. And also, I would like to say that we need to continue these conversations. We need women in global health on the table. We need PMRC on the table. We need academia on the table. We need the human resource on the table, because this is a whole of society effort, and really it needs all of us to bring these conversations right into the decision-making table so that we can address them. Thank you.
Thank you so much. A lot of important points raised there from all the speakers, and I think that's a good way to wrap up this conversation. However, before we wrap up, we do have some questions and comments in the chat box. So if you allow me just in like 2 to 5 minutes to ask some of these questions so that our audience also have an opportunity to hear from our speakers. So I saw the first question from Neema. I'm just looking for that question. Neema, if you can unmute your mic, please go ahead and ask your question.
Hi, thank you so much. Interesting discussions. I've learned so much. I thought we've exhausted much on gender, but there's a lot to go ahead. So due to lack of time, I just wanted to find out, are there any already existing maybe structures or bodies, either public or private, that can already maybe begin to work on the takeaways that we have for this meeting? For example, we talked about the monitoring and evaluation of some of these policies that are already good and ready to go. Are there any already existing institutions that can take that on? Because I really think it would be good that they already begin to get addressed, because if we wait any longer, I think we'll be back again, probably here again next year. So it would be good that maybe next year, during a webinar maybe like this or at a conference, we can maybe highlight that we followed up on this particular policy, and now it's either law or it has just moved a step ahead. Thank you so much.
Thank you so much, Neema. Good question. I will ask Dr. Mwale to quickly address it, and then we will wrap up. I've gone through the comments. Most of them are comments and acknowledgements. So I think we can decide to wrap up after Dr. Mwale addresses Neema's question. Thanks, Neema, for that brilliant question.
Thank you so much for that question. So from the government level, unfortunately, we no longer have the Ministry of Gender that we used to have, but we have the Gender Division under the Office of the President at Cabinet Office. As a Global Water Partnership, we've engaged them on a number of occasions. So I think what needs to be done is when we have such fora, we can even actually invite them to such discussions. And then also if we have some suggestions or points raised, we can always share with them. I think the directors there are very receptive, and also the PS who sits in that office. And also when it comes to NGOs, of course, we know these are very good with advocacy, and they also engage even up to the presidential level. They've engaged him on several occasions. NGOCC is one which coordinates issues to do with women empowerment and all. I think that can those two can really help in the process. Yeah.
Thank you. Thank you so much, everyone, for your active participation during this webinar. I think it has been incredibly productive, incredibly informative. We have discussed about a lot of important issues that we not only need to keep talking about, but my issue is we need to action, whether it is quality education, what are the practical steps to make sure that is done, whether it is ensuring political will, what are the practical ways of ensuring that is done, monitoring and evaluation, training and empowerment, what are the practical steps that we can take as women in global health or as women and men fighting for this agenda? What can we do? That, for me, I think our call for action should be very, very clear, very practical. It should have timelines so that we don't keep on talking about the same things. We don't keep on having the same webinars and yet things are not moving. So I would like to thank our esteemed panelists for a wonderful discussion this afternoon. I would like to also thank our participants for joining and actively participating and staying with us till the end, even after going over an hour. So thank you all. And I'm wishing everyone happy Women's Day or Women's Month. March is Women's Month. And I hope in the next discussions that we have, we will be able to highlight the things that have been addressed, and we'll be able to see a pay gap that has shrunk. Thank you so much. Have a great rest of your day.